family doctor we had, phone him up, go down, put the prescription in, and then I'd be gone. You go to that walk-in clinic, you're waiting and waiting and waiting. Sit there for 2-3 hours waiting to get in. I wanted a doctor.
I've been here for approximately 10 years. When I first joined the practice, it was 4 independent medical practices under one roof. So there wasn't a whole lot of true collaboration going on at the time. We've brought Marla in to join our practice. She has a practice which is going to be approximately 800 patients, and she is their provider.
The patients that I accept here are off the provincial registries. Our staff here gets them, and then they make a phone call and explain that they've been accepted to this collaborative practice. Their provider would be a nurse practitioner.
I didn't even know what a nurse practitioner was, so I said, well, and somebody told me, she can do everything that a doctor can do, really, you know. And if she runs into trouble, she just goes sees a doctor.
It's the same thing I had when I started my practice. I looked to other more experienced physicians to give me support in how I manage my patients. So that's the model we have here. So she has her own practice that she's managing herself, alongside of my own practice that I'm managing with my family practice nurse.
Oftentimes the physician that I chat with will come in to assess the patient with me if I think that that's needed, and we'll get them where they need to go. As far as patients go, they've received me really well. A lot of them have been on the 811 provincial list for years, some of them. So they're just happy to have a primary provider.
They seem that they got a little more time than a doctor. She'll talk to you and she'll explain everything. That's, you know, it's not just like in and out. And she'll ask you any questions you want to know about, just ask.
Every town and every community has their own complexity, which translates to their own diverse needs in terms of how clinics are set up and how collaboration works. What we've had here is a very grassroots approach, and us working with NSHA and identifying what would work in our building, in our town. And so far, at least, we've been extremely supported in that process.
I think if you have the right people in the right place at the right time, then I think collaboratives can work really, really well.